wanted to speak today about common migraine triggers and things that can influence the migraine cycle. What we know is that there are a number of lifestyle and/or environmental factors that can promote dysregulation and trigger a migraine. So because migraines are considered a threshold disorder, what we like to think about is anytime our body is in a dysregulated state and reaching that point of a threshold, that's when a person can be at a risk for experiencing a migraine headache. So listed here are a number of those lifestyle and environmental areas, and I'm just going to talk through how these things can either promote dysregulation in the body and increase the likelihood of having a headache, or things that we can do to help promote regulation in the body and decrease the risk of experiencing a headache. So under the category of diet, we look at things like the timing and the frequency of meals. If we're going really long periods of time without eating, or we're skipping meals, there is this blood sugar dysregulation that can be the risk factor that gets a person closer to that threshold and experiencing a migraine. And that would be sort of the dysregulated state. So to counteract that, we encourage people to eat at consistent and regular frequencies to keep that blood sugar release stable, in the hopes of helping to prevent experiencing headache onset. There's also specific foods that can trigger migraines. There are certain inflammatory foods, alcohol, caffeine. There's a large list of foods that some people will notice when they consume those foods, it causes a headache. That's not the case for everyone, but some people have some sensitivity to specific foods. From a medication standpoint, the other thing we want to be mindful of is just how a patient is maybe using their abortive medications. With certain abortive medications, there's a risk of medication overuse headaches. And so if they're using those medications too frequently, the medication itself can actually be contributing to the frequency of headaches and migraines that they're experiencing. A couple of other things in diet are just looking at things like hydration, caffeine intake. That can also impact the vasoconstriction and vasodilation of blood vessels, and that can bring a headache on as well. If we move on to something like sleep, essentially sleep is a very restorative time for our body to heal itself. And so if a person is experiencing disrupted sleep patterns, whether that means the timing varies from day to day, the quality of their sleep is impacted, maybe they're waking up frequently throughout the night, all of that can kind of change the chemical and hormonal regulation that occurs during those sleep hours. And so if sleep is disrupted or variable or inconsistent in any way, it can increase that risk for having a headache. So what we want to work on with patients is trying to keep that sleep routine as consistent as possible, minimizing the amount of variability of the timing of when they go to bed and when they wake up as much as possible. And then also looking at things like sleep hygiene strategies that can just help improve the quality of their sleep as well. Hormonally, we know that there can be hormonal fluctuations around a person's menstrual cycle, or if they are undergoing menopause, there are just changes in levels of progesterone and estrogen. And so during those hormonal fluctuations, that is dysregulating for our body. Our body doesn't, expect that on a day-to-day basis. And so that can be the cue to the brain that something is dysregulated. We don't have as much control over that from a self-management standpoint, but what we do like to encourage patients to do is kind of just track their hormonal fluctuations, track their menstrual cycles, being aware of when those hormonal fluctuations may be happening so that they can compensate by making sure that all of these other lifestyle areas are as regulated as possible, just to reduce that overall risk of triggering a headache. And also just getting some insight and awareness as to when they are at a higher risk for experiencing a headache or migraine. Environmentally, we see that patients tend to be a little bit more sensitive to environmental changes, whether that's significant changes in weather from hot to cold temperatures or changes in barometric pressure, exposure to bright lights or strong odors. Sometimes airplane travel can be a trigger for people. And what's interesting to note is with pain conditions, not only do we see this hypersensitivity of that pain response system, but we do tend to see these other changes in just sensory sensitivity overall to things like light and sound and smell. And so when patients that experience headaches or migraines are exposed to those things, they may in fact actually trigger a headache or a migraine. So again, we don't always have full control over those environmental factors, but if we can be aware of when we are at risk for being exposed to them, we can put in some compensatory strategies into place, like wearing sunglasses and hats and headphones or earplugs, or pacing ourselves so that we monitor the amount of time that we're exposed to those triggers, to hopefully reduce getting to that point of nervous system dysregulation. Stress is, of course, a common trigger for many people with headaches and migraines. And, the main reason that stress can cause dysregulation in our body is the way that stress increases that release of cortisol. So we typically have a certain amount of cortisol day to day, and that's okay for the body. But when we're in a prolonged stress cycle, that cortisol, that expected cortisol level is higher than its normal range. And so that's the cue to our brain that something is dysregulated and makes it more likely that we'll experience a headache. The other consideration with stress is when someone experiences stress, it tends to have these secondary effects on these other lifestyle areas. So I know when I am stressed, I might not sleep as well, or maybe I work through my lunch and now I've skipped a meal. And so this sort of compounding effect can happen where stress, lack of sleep, impaired eating routines kind of gets you to the point of experiencing a migraine. So we really want to be mindful of how is a person managing their stress, either preventing stress or managing it in the moment so that there isn't as much of that dysregulation going on. There's also a phenomenon known as stress letdown. And this is the idea that once we've gotten through a really stressful event and when we should feel really relaxed and at ease, that's the time that a headache or a migraine gets triggered, which is really frustrating. But if we think about it, our body's really great at adapting in the moments of stress, and we can use that adrenaline and cortisol that's getting pumped through our body during the stressor itself. But once that stress event is over, there's this significant crash and drop off of that cortisol and the adrenaline. And because we've gone from such a high level of cortisol to such a low level so quickly, that can be the trigger that a person experiences. And then this last category of lifestyle factors that could be contributing is looking at physical triggers. So either structurally or anatomically, there may be some structural components to why a person is experiencing a headache, but also thinking about just overexertion. Anytime a patient pushes past their physical tolerance of an activity, that can be dysregulating. And so if we overexert ourselves with exercise, or we decide to clean our whole home in one day without taking any breaks, those are things that could cause a headache for somebody. And that's where we'd want to work on things like pacing, moderating activities and rest cycles, and kind of finding a balance so that we're staying within a person's tolerance rather than pushing past it and triggering a headache. Also things like visual triggers, eye strain, prolonged exposure to blue light and screens, and kind of becoming too fatigued and too tired on the other end of the spectrum. So from a lifestyle and a self-management standpoint, this is where we can help patients understand what to look out for in their everyday routines that could be contributing to their pain, but also thinking about what are some ways to counteract that, working on things like improving timing of meals, improving sleep quality, learning how to manage stress more effectively. And that's where occupational therapy can be a great tool for many patients with headaches.